In this video, we will provide specific tips and recommendations for managing common situations in diabetes management while using the iAPS automated insulin delivery system. These tips are in addition to the general guidelines covered in the General AID Systems module. We will cover strategies for handling hypo and hyperglycemia, dealing with high-fat meals, managing diabetes during physical activities, coping with illness, alcohol, and planning for travel. By implementing these tips, you can optimize your glucose control and enhance your overall diabetes management with iAPS. 1. Hypoglycemia. With an automated insulin delivery system like iAPS, you often require fewer carbohydrates to treat hypoglycemia compared to traditional diabetes management, especially when you have little insulin on board. iAPS provides the ability to see your insulin on board on the home screen. If you haven't had insulin in the last few hours, a smaller dose of carbohydrates is usually sufficient. It is recommended to enter the carbohydrates you consume to treat or prevent hypoglycemia into the algorithm using the Meal Action button. This allows the algorithm to consider the carbohydrates when calculating insulin requirements, and you will typically only receive insulin as needed. To prevent further episodes of hypoglycemia, you can make adjustments in the iAPS system to reduce insulin delivery. This can be done by using a higher temporary target value via the Temp Target button or via a profile switch. You can also choose to reduce the percentage of insulin release in your profile. Remember that if you reduce your profile by, for example, 50%, this will not only reduce your basal insulin rate, but also make your carb ratio and insulin sensitivity 50% less aggressive. Via more options, you have the option to not apply the percent to your ISF and carb ratio, or also turn off SMBs, which might be a good strategy if you're experiencing hypoglycemia. It's important to note that in some cases, the algorithm may increase basal insulin even when you are experiencing low glucose levels. This could be necessary if the predicted glucose level is higher than the target value. In the majority of cases, iAPS is accurate regarding its predictions. 2. Hyperglycemia. In the case of mild hyperglycemia, it is generally recommended to trust iAPS and allow the system to work on its own. However, you can consider giving a manual correction bolus using the bolus calculator without entering carbohydrates. To address hyperglycemia, you also have the option to increase the percentage of insulin release in your profile or temporarily set a lower target value. In situations of prolonged and severe hypoglycemia, it is important to consider the possibility of an infusion set problem. When in doubt, it is advisable to change your infusion set or pod. Remember the phrase, if in doubt, change it out. It is essential to ensure that you have enough equipment on hand to carry out all necessary substitutions and replacements. Being prepared with the required supplies is crucial for effectively managing hyperglycemia and maintaining the proper functioning of your iAPS system. 3. High-fat meals. When consuming a high-fat meal while using iAPS, there are several recommended approaches you can consider. 1. In iAPS, you have the flexibility to include carbs, fat, and proteins into the bolus calculator. Via the settings, you can see and adjust how these fats and proteins are taken into account in the calculation of the insulin delivery. 2. You can also enter only 70% of the carbohydrate portion, allowing the algorithm to account for the remaining portion. An alternative approach is to set a temporary profile with a higher insulin delivery of, for example, 130% for 2 to 3 hours to take into account the slowly absorbed part of the meal. 3. Another option is to administer your bolus in 2 parts. For example, you can deliver 50% of the insulin dose before the meal and the remaining 50% 2 hours later. In the app, it is also possible to enter carbs in the future, but not an insulin bolus in the future. It's important to note that individual responses to high-fat meals can vary, so it may be helpful to experiment with different approaches and monitor your glucose levels closely to find the most effective strategy for managing your blood sugar levels during such meals. 4. Exercise. When participating in physical activities with iAPS, it is advisable to implement the following strategies. 1. Most people use a dedicated profile in iAPS specifically designed for exercise. This profile should incorporate a higher target glucose and a lower insulin delivery percentage to accommodate the impact of physical activity. 2. You can also just set a higher target value before and during exercise to mitigate the risk of hypoglycemia. 3. In iAPS, you have the option to disable SMBs when using a higher target value. This allows for more conservative insulin delivery during exercise. 4. As discussed in the general AID module, it is also recommended to reduce your mealtime insulin if you exercise within 3 hours of your meal. 5. Take advantage of the integration capabilities of iAPS by connecting your dedicated iAPS app to an Apple Watch. This allows for convenient monitoring of glucose levels and trend data during exercise. It's important to remember that these recommendations serve as a starting point, and adjustments may be necessary based on individual responses to exercise. Regular monitoring, self-observation, and collaboration with healthcare professionals will aid in refining insulin dosing and achieving optimal blood sugar management during physical activity with iAPS. 5. Illness. During illness, it is generally recommended to keep iAPS in closed loop unless advised otherwise by your healthcare provider. Please refer to the guidelines about illness discussed in the general module on automated insulin delivery systems. 6. Alcohol. When consuming alcohol while using iAPS, it is important to take certain precautions to prevent hypoglycemia. Here are some recommendations. You can adjust your target value to a higher level than usual, or set a lower % of your insulin profile when consuming alcohol. This can help prevent the system from administering excessive insulin in response to any increase in glucose levels. It is worth noting that simply consuming more carbohydrates is not an effective strategy to prevent hypoglycemia, as the automated insulin delivery system will compensate for any rise in glucose levels by increasing insulin delivery. Always monitor your glucose levels closely when consuming alcohol and be prepared to make further adjustments as needed. 7. Travel. When traveling with iAPS, it's important to be prepared and consider some specific factors. Here are some considerations for travel. 1. Ensure that you have enough diabetes supplies, including insulin, infusion sets, sensors, test strips, and backup devices, to last throughout your trip. It's always better to be prepared with extra supplies in case of any unexpected situations. 2. When traveling by air, you may need to make some adjustments. Keep in mind the following. The Bluetooth function of your mobile phone, pump, and transmitter can typically remain on during the flight. If you're instructed to activate airplane mode, there's no need to be concerned, as iPhones will still maintain Bluetooth connectivity even when airplane mode is enabled. During the flight, the Wi-Fi, 4G, and 5G connectivity of your SIM card will not be available. This should not affect the operation of the iAPS app, as it will continue to function perfectly via Bluetooth. However, the data will not be forwarded to Night Scout until you regain a stable internet connection. The iAPS app usually detects time zone changes automatically and adjusts the time accordingly, although depending on pump and CGM setup, jumps in time can lead to problems. However, it's a good practice to double-check the time settings in the app after arriving at your destination to ensure accurate data recording. Remember to always comply with airline regulations and guidelines regarding the use of electronic devices, and inform the airline staff that you are wearing a medical device, such as an insulin pump. By taking necessary precautions and planning ahead, you can enjoy your travel while ensuring the continued functionality of your iAPS system. In this chapter, we covered how to manage special situations such as hypo and hyperglycemia, high-fat meals, exercise, illness, alcohol, and travel with iAPS. We provided recommendations and strategies to address these situations effectively. You've got this. Remember, individual responses may vary, so experimentation and monitoring are key. Seeking support from the iAPS community and healthcare providers is also valuable. By leveraging iAPS and connecting with peers, individuals can navigate these situations and improve their diabetes management effectively.